Hello everyone, this is Dr. Khan, Executive Plastic Surgery, Bloomfield Township, Michigan. So I've just taken care of a lady, early 30s, 32-year-old from Canada, so out of the country. So she had 600cc implant, 600 cc's on the left and right from 2016, so just 8 years ago. And so she ended up having the symptoms of breast implant illness. She ended up getting an ultrasound in Canada only to find out that not only the right but also the left one was ruptured. So which is very interesting in just 8 years of having silicone implants. Now the goal here is to have it all contained, and so she came to me, she got the medical clearance, and as you will see right here, I did 100% total capsulectomy. Initials here 7/16/24. This is where I removed the excess skin. This implant was serving as a tissue expander, if you will. And as you will see, I did the end block on the right side, all contained. You can tell just by looking at it how attenuated it is. There's no boundary, and it's just like ruptured on the inside. As you can see, some of the inflamed tissue I removed, which is pathologic, looks abnormal. So as you can see, I'm going to go ahead and go in, and you can see below the muscle, this was very tedious, over basically 6 ribs and extended all the way up. And as you will see, it was all contained. None of this built into the chest, and which is what the intended goal of the surgery was. And as you can see clearly, this is what is a ruptured implant. Now this is supposed to be the safer, better, cohesive gummy bear implant, and as you can see, there is nothing safe and nothing cohesive about it. As you can see how it literally is disintegrated, like blown apart, and you can see how it just wants to flatten out. And if I put this on top of a ruler, you can see it is so thin you can read the ruler. So it says 4, 5, and it doesn't take much. This is just my first case for the day. It's almost noon, and I started early in the morning. Patient was here at 6, and as you can imagine, very large capsule for what is a very large implant, and look how it has disintegrated. So if anyone says gummy bear implants are safe, I want to challenge this picture. This is absolutely done in what is the end block fashion. I'm just going to put this ruler here so we can continue to go on with the picture. And as you will see right here, look at this implant, completely disintegrated in just 8 years. So that's the other irony. And a young lady. I'm going to go ahead and remove my top block. Now the left one was, I would say, the most difficult implant that I've done this year. Clearly, it was elongated, going from the bottom of the chest towards the clavicle, and it was extremely tedious. Now, as you will see, as I was dissecting, this is the part that was above anterior. This is the part that was right on top of the rib. Now, there was an inevitable break in the capsule as occurred, and as I was dissecting, as soon as this break occurred, what I did was I took this Raytech, and I used this and multiple Raytechs to use as basically a sealing agent, if you will. And as you can see how it sticks. So as soon as this occurred, I took this and I put it such that none of this spilled into the chest, and I dissected again a little bit more. Now you will see, look, this is the cartilage part of the rib right here. And you can see I was right on top of the rib. Then I dissected a little bit more, and lo and behold, another rib. So rib, rib. And so you can see actually the markings of the rib and the intercostal fascia. And then I dissected a little bit more, then another. So rib, 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 and this is indeed the hardest part of the case. You can see, if you look carefully right here, this is the fascia of the intercostal muscle. Now, if anyone says you cannot do it, you certainly can. Yes, there was a break, so this is not an end block. This is 100% total capsulectomy. There is no spillage, and I'm able to use 16 of these in order to seal, and as I dissect, block this. And as you can see, none of the silicone is in the chest, no need for the drains, and you can see how thin this is. So what I'm going to do now is I'm actually going to go in, and I will also show you, if you look over here, this is the cartilage part of the rib right here. right here, and this is the cartilage part of the rib, and then rib. So as I go in, clearly all contained. I want to show you how thin this is. You can see my scissor, and very tedious dissection, very large implant, both ruptured as was seen on the ultrasound, and as you can see, all contained, and you can see how badly disrupted this is. And again, this looks much more like opaque cosmetic surgery. And look at this very thin capsule. And again, just like you saw on the ruler, you can see my blue glove. You can see the scissor right here, very thin. All of that capsule completely, sincerely, definitively removed. You can see some irregularities over here. So, and let's go ahead and let me touch this now. As you will see, there is nothing safe about this cohesive gummy bear implant. Look at the way this has literally kind of retained its volume, but this one is more like milk, honey slash, if you will. And so none of this is safe. These are just 8 years old, from 2016. And so this goes to show you implants can rupture technically even 8 years into an augmentation. And this is why the manufacturers themselves tell you, if you look at the brochure on the Mentor advertisement itself, you will see that they recommend getting an MRI at year 3, and then every 2 years they're onward looking for what is a silent rupture. So now, let me go ahead and now feel this overall. Nothing out of the ordinary that I see. So the take-home message is, the capsule must always be removed en bloc fashion, which is the gold standard. Let me get this done. So the capsule must always be removed with the implant in en bloc, which is the gold standard. No matter what, none of this should spill into the chest. As you can see, look at this wet part of the silicone. If this cannot be accomplished, then, and it's this way where you have plugging of that break in the capsule in a very sophisticated way such that none of the silicone spills into the chest, can be very safely and definitively accomplished. Making sure that all of the capsule is removed, 100% total capsulectomy with 0% of the capsule remaining behind, all inflamed tissue is removed, and there is no spillage of the silicone into the chest. And I couldn't be happy with how the surgery was done. It was a very long surgery, and like I said, this was the most difficult surgery that I've done this year to date. So there you have it. Implants are not safe devices. If you have any irregularities, pain, you should certainly seek attention. Majority of the ruptures that occur are silent ruptures. That means the patient doesn't know, neither does a plastic surgeon. The only way you find out is by doing what is an MRI without contrast. This lady is from Canada, so the only thing she could get in a timely fashion was the ultrasound, which showed that bilateral rupture, to her surprise. So there you have it. This is Dr. Khan, executive plastic surgery. If I may mention, she did not need the lift. She did not need the drains. The capsules will be sent to pathology, rule out the BIA, ALC, LCD30 analysis, rule out lymphoma, rule out breast cancer. Number 4, cultures for aerobic, anaerobic, and fungal. 5, twilight sedation. Number 6, pictures, videos of the chest, and showing complete removal, and obviously what you see right here. Number 7, you have the implants will be returned to the patient. And number 8, no matter what the age, the patients, all of them get the same surgery. There is no compromise because of age or because of radiation or because of the patient's health. All of the patients get the same surgery because it is imperative that the entire implant, capsule, all inflamed tissue is removed without any spillage. Please share it. This is Dr. Khan, Executive Plastic Surgery.